Sniffles, sneezes, and coughs. Must be the start of a new school year. Keeping your student healthy in school is what we're talking about in this episode of The Inside Scoop. Hello and welcome back to another episode of The Inside Scoop. I'm your host, David Owen. After listening to this podcast, if you like it, be sure to subscribe, give us a like, and share it with a friend. You can find this and more than 100 other helpful podcasts on the district's website at cobbk12.org. Just click on the podcast icon at the top of the page or on mobile at the very bottom. Kids get sick when school starts back up. Why is that? Well, here to help us is Melanie Bales, Assistant Director of Student Support and District Nurse Administrator. Did I get that right?
Yes, David, you did. Good morning.
Okay, good morning. Your position is mainly doing what?
So I'm glad you asked. I am the District School Nurse Administrator. So I am ultimately responsible for ensuring that our school health services department and our staff, which includes consulting nurses, itinerant nurses, and school nurses, that all of us are prepared, trained, and ready to do our jobs to keep our students and staff healthy and safe.
That sounds like a pretty big lift. I mean, that's we're anticipating 108,000 students, I think it is.
Yes.
So you have a staff. You got school nurses, right?
Yes.
Do you, off the top of your head, do you know how many school nurses you?
We have about 120 nurses in our school district.
Wow.
That are ready to assist students with whatever their health needs are.
120. That we've got 100 and I hear different numbers, but 113, 114 schools. So you've got one for every school.
Yes, absolutely. We are very fortunate to have an RN or an LPN in every single one of our schools.
Wow.
All day, every day that our students are in session.
That's amazing. So, and you've got, I presume the rest of them are what, substitute nurses?
Yes, so the rest of the nursing staff would include our consulting nurses. They are nurse managers for those nurses out in the schools. We have 2 itinerant nurses that travel from school to support our nursing staff and meet the needs of students. And we also have licensed substitute nurses that fall under school health services.
That is amazing. We really are blessed in Cobb County to have that kind of support.
We are.
So at the open there, we were talking about how, it seems like the first 2 or 3 weeks of school, kids come home with sniffles and all sorts of little things. Can you tell us a little bit about what's going on with that? And then we'll dig deeper into, maybe how we can prevent some of it.
Absolutely. So a lot of that's attributed to the fact that all of our students are back in school together. And so they've been enjoying the summer break, but they are back in school together and they are sharing their germs with their friends.
Well, isn't that nice? That's
Yes.
just so thoughtful. Our kids share, but that's not one thing we want them to share, right?
Absolutely. And so pretty much a lot of those are viruses. This is information that's shared through Children's Healthcare of Atlanta. Your pediatrician can share that as well, but they're back together, they're in large groups, and they are sharing germs. And as a result of that, it is easier for some students to get sick when there are large groups of people back together again.
Yeah, that kind of makes perfect sense. So is there any one type of thing that tends to pop up? Is it primarily viruses that
Absolutely. It's primarily viruses. And so one of the ways to keep, or several ways to keep that at bay, you didn't ask me that yet,
well,
but is it okay for me to share?
Absolutely. That's kind of what we're here for.
Okay. Would be, first and foremost, is good hand washing. And so that's just one way to keep our germs at bay. And that's not only for our students, but that's for staff as well. Making sure that you get enough rest and enough sleep, especially with the weather being the way that it is, as hot as it is, it's important to stay well hydrated. If you can also try to work through ways to minimize stress and keep that at bay. So rest, of course, and the appropriate amount of sleep per your age is very important. And balanced meals, eating healthy snacks.
That's impossible.
Well, it is possible. It just takes a little bit of work, but definitely making sure that you eat good, nutritious, balanced meals and getting exercise.
Okay. Well, the exercise part, if you can get your kids peeled away from video games and that sort of stuff or social media, then exercise kind of comes naturally to them, right?
Absolutely. It does. It sure does. So outside time, if the air quality permits, but just thinking about some other physical ways to engage in exercise so that you're not in front of the screen for most of the time that you're home.
Well, I would dare say, as a parent of teenagers, if you can do that, that's quite an accomplishment right there.
Absolutely.
So, nutrition, sleep, hand washing. We learned some things, and this is a curveball. I apologize if this is, not something you're anticipating, but we learned some things from the pandemic. Would you say that hand washing was maybe the biggest way to mitigate any spread of things?
Sure. I would say hand washing as well as good respiratory hygiene.
Yeah.
And so when I say good respiratory hygiene, that means covering coughs and sneezes, using a Kleenex or using the bend of your elbow.
Yeah, cough into that elbow.
Yes, cough into that elbow. But if you are covering your coughs and sneezes with Kleenex, for instance, once you discard that in the trash, you should wash your hands appropriately. And then I would say another way to definitely mitigate the spread of germs would be to stay home when you're sick.
Okay, so now the question is, when does the parent say, okay, this is a stay-at-home moment versus
Absolutely.
My kid's just pretending and doesn't want to go back to school for whatever reason? What are the key objective, I guess, telltale signs you should keep your kid at home?
Okay. So our school nurses do a fantastic job of sharing a graphic that we have entitled, I Need to Stay Home If. And so if your child has a fever of 99.5 or higher with additional symptoms, such as coughing or sore throat, it's best for them to stay home, follow up with your healthcare provider. And if you've had to administer medications, fever-reducing medications, they should be off of those for 24 hours without a fever before returning to school.
That I'm sorry to interrupt you, but that's the key, parents, right?
Absolutely.
You can't give them an Advil or whatever, and the temperature's down, so you can go to school.
Right.
Right.
Absolutely. And that just means that the medication has worked the way that it's supposed to, which is great. However, once you remove that medication, do they have a rebound fever? And so that's important to make sure that you're tracking at home.
Do they have a natural fever?
Absolutely.
Period. Okay.
Absolutely.
And just also out of curiosity, why 99.5 and not 100? Do you know what that criterion was?
So that's, that's some of our evidence that is research-based. And typically, students aren't feeling very well. And so it is very difficult to engage in class. You are there physically, but you may not necessarily be feeling well enough to engage in class. And then, guess what? You're sharing those germs with others. And that's like a cutoff temp, or that's a signal that something may be going on in your body. That's your body's natural way of fighting off a virus. That's sometimes one of the first signs that you will see is an increased temperature. But we want to make sure that fever or low-grade fever, in addition to other symptoms, that you are monitoring that at home and you're following up with your healthcare provider.
Okay, now I rudely interrupted you before.
That's okay.
I apologize, but continue, if you will, with what are some of the signs that you need to keep your child home for the day?
Okay, so if your child is vomiting, for instance.
Well, yeah, and there's your sign.
It's very important for them to stay home, especially if they have had more than one episode in the last 24 hours. And again, we're always going to recommend that you treat them according to whatever your process is at home, but also we encourage you to follow up with your child's healthcare provider. If they've had diarrhea, the same kind of thing. Within the past 24 hours, it's important for them to stay home just to be monitored appropriately and to help keep their germs to themselves. If they have a rash, a body rash that's itching, that's also associated with a fever, it's important for them to stay home so that you can seek the appropriate care or provide the appropriate treatment per your physician's recommendation at home.
Okay, so if it's associated with a fever of any level, or does it have to meet that 99.5 threshold?
So it's the 99.5 plus those other symptoms.
So
or sometimes there may be, because the nurses will call if there is a suspicious rash that a student presents with or comes to the school health office with.
Okay.
That may or may not be associated with a fever, but if they are uncomfortable, if they are itching, if they have maybe pain that's associated with it, we will contact the parents to pick them up.
I would say if a kid is sitting there scratching all day, they can't really learn very well, right?
Yeah, that is very distracting for them. I would definitely agree with you. That is very distracting. Students who have active head lice, we want to make sure that they would be treated appropriately at home, and then they can return to school, of course. And if you have red, itchy, draining eyes, it's very important to stay home.
Okay, this is just such a lovely podcast. It is what it is. Sickness is not a pretty thing, people. So is that a common thing with, I guess you're talking about possible pink eye emerging?
Pink eye. So it's important to note that our school nurses, we don't diagnose. And so we will contact you with any symptoms that your student may present with at school once they come into the school health office to visit the nurse. But it is very important to remember that we don't diagnose. That would be the responsibility of the student's physician, their pediatrician, or nurse practitioner, or even at the health department if they are seeing a licensed healthcare practitioner there. That
is fascinating, because I never even thought that there would be a limitation on that, but it kind of makes sense. They don't know every single student's medical background, so there's no way they could really.
Absolutely. That is correct. And you have to remember, while we are licensed nurses, we are practicing per the dictates of the Georgia Nurse Practice Act.
Sure.
And so it doesn't matter whether you work in a school or a physician's office or a hospital, that is not within the scope of practice for nurses to diagnose.
So it's kind of like with a teacher having a teaching certificate, a certification that they kind of know what they're doing in the teaching.
Absolutely.
Or absolutely know what they're doing in the teaching arena. So it's the same with nurses?
Absolutely. Absolutely.
Okay. Well, now I have been on the receiving end of a phone call from my kid's school nurse, and she starts off something like, Mr. Owen, first let me tell you, everybody's fine. That's always the good. Mitigating. Yeah, it's a nerve calming thing to get
absolutely.
That. But then they follow with, you need to come pick your child up.
Right.
Each school, I'll pose this as a question because I'm not certain of it. Does each school have its own procedures for doing that?
That is a district-wide procedure that we follow.
Okay.
And consistency is key.
Yeah, that's
and that
true.
is one of the priorities that our superintendent asked that we adhere to, but consistency is key. And so we are very intentional in ensuring that we have the same process across the district, regardless of what school your child is in. And so, and that information is also in the family resource guide that parents and guardians have access to.
Oh, yeah. That's a huge document.
Absolutely.
Take the time to go through it. It's worth going through.
Absolutely. And so there may be an initial call just to inform a parent or guardian that their child was seen in the school health office by the school nurse. And sometimes if there is a second visit, then it may escalate to the point of needing to pick your child up from school. And so Administrative Rule JGC-6 within our school district policy handbook guides us on when we should contact parents when their students have been seen in the school health office. That may be a phone call, it may be a note home, which is a school health office visit note, or it may constitute your child needing to be picked up from school. And so if that happens, depending on what's going on with them, a fever that is over 104 and you aren't able to get there within 15 minutes will warrant a 911 call for your child's health and safety.
Yeah, because isn't there risk for brain damage when fever gets that high?
Well, it is, and then there is a risk of a student perhaps having what's called a febrile seizure, and so we want to make sure that we have emergency personnel on site so that we can keep the student safe. Otherwise, if you are contacted to pick your child up from school because they may be sick, then we do provide an hour for you to get there. The traffic and navigating it in Metro Atlanta can sometimes be challenging.
Oh, yeah.
But that has been, a procedure that's been in place for a number of years.
Okay, so now let's move to the next step of you got a kid that either had to be picked up or had to stay home from school that day. You got to have a plan B, right?
Absolutely.
Especially if you're a working parent.
Absolutely.
Are there some ideas that you could offer parents who maybe both parents or maybe a single parent taking care of a kid needs to stay home, but they also are really being pressured to work?
Absolutely.
How do they work through that?
And that's a very difficult and challenging position. So, and it's something that, we have been navigating for a very long time. But we do definitely encourage that there be additional emergency contacts that are listed. Or if you are in a situation where you absolutely cannot leave, there may be someone else that you can contact to pick your student up from school, but there's a procedure that we have to follow. And so that may mean you needing to contact the front office staff or the principal to notify them. But we do definitely ask that parents and guardians try to plan ahead for those days. I don't think any of us want to start the school year anticipating that our child may become ill while at school,
right,
or have an emergency while at school. But it is so very important to be proactive and plan for those occurrences.
There is no doubt that you have shared some very useful information here. I really appreciate you coming in and sharing your expertise.
Absolutely.
I didn't ask you this at the outset. How many years have you been with the school district?
So I am starting year 22 this year. I have worked in our school district as an elementary school nurse.
Okay.
I started in 2002. I've worked as a consulting nurse. I've worked as an itinerant nurse where I've traveled around. And I've actually been in this role as the district level administrator for our school health services department since May of 2016.
So all of this experience comes to bear here for our listeners to benefit from. So thank you so much for coming in and taking the time to share that with us.
Absolutely. I appreciate the invitation.
Absolutely. And if you heard something helpful in the podcast, please make sure that you give us a like and share it with a friend. Your friend may very much appreciate knowing the same stuff that you've just learned. You'll find us wherever you normally get your podcasts. Also, let us know what you think using the link in the show notes. As always, thank you so much for listening to this edition of The Inside Scoop, a podcast produced by the Cobb County School District.